Welcome back. The month of September is nationally recognized as Suicide Awareness Month. And while not everyone struggles with suicidal thoughts, it's still one of the leading causes of death in the U.S. Joining us with more about awareness and support, we've got Dr. Bitner in studio. This is something that it seems like so many are struggling in silence. We'll see the headlines of maybe a celebrity, dying by suicide, and it's like you never realize what they're struggling with behind closed doors.
Exactly. And mental health, I was thinking about this on the way in. It's messy, right? And mental health is not well cared for. We don't talk about it in schools. We don't talk about how people can cope. And then when people are confronted with issues like, how do I cope? And then they tend to get in this vicious cycle, and unfortunately sometimes it really can spiral quick.
Right. So having a mental health issue would be a risk factor, but what are some other risk factors that could possibly lead to suicide?
Yeah, family history of suicide is certainly a risk factor. It is having substance abuse issues or having that be a way one copes. It's looking at serious or chronic medical illness. People feeling hopeless. Am I ever going to get better? Why do I, have this issue? If, of course, people have had mental or physical abuse, a lot of times people just, again, get stuck in that hopeless feeling, and it's really hard to get out.
Yeah. So what can we do if we see a loved one, a family member that may be struggling, maybe giving us signs that we should be concerned?
Sure. I think, number one, it's not to be afraid to talk about it. A lot of people think if I mention suicide, if I mention, do you have plans? They think they might push someone to do it, and that's not true.
Yeah.
Just by bringing it up sometimes gives people a pause to say, okay, I can talk about this. This doesn't have to be so scary. So don't be afraid to talk about it. You might save their life just by saying, we need you in this world.
Yeah. And speaking of talking about it, we also have to look at changing the language about how we talk about suicide.
Yes, and I love Vonnie Woodwork is here in town, and she's such an advocate for people with mental illness, and she really is pushing to change the definition. She's taught me this. It really made sense to me that we focus on the illness, not the act. So this isn't someone that's committing a crime, committing suicide. We need to stop that language and say they died by suicide. Looking at it as a consequence of mental illness, not an act.
Let's talk about Jane here.
Yeah, so Jane, I think this is critical. So Jane came to us. Her sister made her make the appointment. She was really getting into a spiral. She had had a long history of mental illness in the sense of postpartum depression, PMS, hormone-related mood disturbance. And she was in perimenopause, not sleeping, and really, again, spiraling in some dark thoughts. And her husband was supportive, her sister, and this was different. She was starting to have thoughts. She didn't have a plan, but getting there. And so, what I told her and her sister who came to the appointment was, menopause doesn't cause mental illness. Menopause, the symptoms can make it worse. So Jane not sleeping made her start to spiral more. So in conjunction with her psychiatrist, with her therapist, we were able to offer her hormone replacement therapy. So now she was able to sleep. The estrogen really helped her with the hot flashes and night sweats, helped her with sleep. And the progesterone helped her in terms of settling her brain, helping with sleep and being calming. So altogether, her team rallied around her. I wish everyone had that team.
Yeah.
So it's so important for us to ask for help.
Yeah, changed her life, it sounds like. What's your takeaway tip for us this week?
Takeaway tip is don't suffer in silence. Know, for example, even that menopause can make it worse, but don't be afraid to talk about it.
Yeah.
And lots of tips, and change your language.
Such an important advice this morning. Thank you so much, Dr. Bitner. Appreciate your time. We'll be right back after this.